Good morning. This is November 23rd, 2008. I'm Robert Recht, St. Louis, Missouri. Didn't think I'd be on YouTube. I thought that was only for the young people. The reason I'm here is I'm angry, I'm perturbed, I'm anxious. We have two giant issues in front of us. The economy that's worrying Congress. They're scurrying around right now trying to do something about it. And the second issue, which has never been this major before, is health care. It's never been like this before. More people are losing it. Companies can't afford to give it to you. Companies are cutting it out. People can't afford it. The prices are so high. Insurance companies are excluding you for pre-existing conditions where you can't even buy it, even if you make $100,000 a year. So what are we going to do about it? And what are our congressmen doing about it? Their job is to take care of us, not themselves, not the lobbyists, not the special interests. And so far, that's what they've been doing, because we've been hurting for a number of years on this health care issue, and they haven't done any real things about it. Anyway, I'm here to complain about it, of course, and show my anger toward my congressman, but I have expectations of them. Now, so far, we've had the health insurance companies, the private health, the for-profit health insurance companies, which have given us our health insurance. They have failed us miserably in the last few years, and it's getting worse, not better. The prices aren't going down, the benefits are going down, and the prices are going up if your company is able to give it to you, your employer. So it's impossible. And if you need anything right now, it's health care. We have more bankruptcies than any other company because of health care. 50% of bankruptcies are caused by health care. We have huge medical expenses. Churches can't get donations anymore because their parishioners, their congregation, can't afford to give donations the way they used to. They're busy paying for health care or asking for donations from the church. Their dependence on the church. That's just one aspect of it. We do have some answers here, and that's what I'm going to tell you about, because I have looked into this issue, and I know there is one good answer out there. There is a proposed law before Congress, and the name of the law, and I'm going to show you a picture of it right now. Not a picture, the name of it. It's called H.R. 676. That's House Resolution 676. It's in the House of Representatives right now. It's not in the Senate. It's in the House. And let me give you an example of what this law does. It's based on Medicare, which has been in here for 43 years. It's been a very successful program. People love it. You've got to be over 65 to get it. There's no pre-existing conditions that eliminate you from prevent you from getting the care. Once you're there, there's no denials of your care. You can have the worst diseases, the most expensive thing, and you're still covered. There are some flaws in the program, but overall, the program is very successful, and it does not have insurance companies. The program I'm going to tell you about is Medicare for all 300 million Americans. It's improved Medicare for all. It's put up there if you want to look it up on the internet by Representative John Conyers, C-O-N-Y-E-R-S, of Michigan. You can get the details of the law. I don't think you need that much. What you need to know is what it's going to do for you. And that's what you got to tell your congressman, what he's supposed to be doing for you, not for himself and the special interests and the lobbyists. First of all, it's Medicare, improved. It has no deductibles, no co-pays. It has all of your medical care taken care of. It takes care of your drugs, your medicine. It takes care of your long-term care, your vision care, your eye care, and your dental care, a big item. It takes care of chiropractic and substance abuse, mental health, and other things more detailed. It covers all the equipment that you might need, a crutch, a wheelchair, a hospital bed, that sort of a thing, at no extra cost. You will pay a premium if you're under 65. Let me say this, if you're over 65, you will not have to buy a Medigap policy anymore. You will not have to go into an HMO. There will be no HMOs because they're insurance companies, and the insurance companies, like in Medicare, are eliminated. This is what American business has done for a long, long time. It's not socialism. This is capitalism at its best. Excuse me. They have eliminated the middlemen. Walmart, IBM, all the big companies, Best Buy, they've cut out the middleman, that expensive middleman, and they've lowered their costs, and they've been able to give you lower costs as a result and higher quality. And that's what this basically is saying. It's going to give you much better benefits and higher quality. Now, I told you what the benefits are. Now, what are your costs? If you're under 65, it's going to go like this. If you're a family of 4, 2 children, husband, wife, your cost, if your family income is $50,000 a year, it's going to cost you $200 a month. No additional cost for all of these benefits. Your drugs won't cost any more, your long-term care, your medical care, you won't have any deductibles or co-pays, your dental care is included, your vision, your hearing, that's all included. If you make $100,000, you're going to pay double that. You're going to pay $400 a month, and still a fraction of what you pay now. You're not going to be paying insurance companies because they're non-existent in this plan. They are eliminated. If you make $25,000 a year, it's going to be about $100 a month. It's on a sliding scale. If you're unemployed, you'll still have health care. It'll be based on whatever income you have, and you won't lose it if you are unemployed or change your employment. Now, how do we pay for it? Not too complicated. And it's been well documented by some of the top economists in the nation that this can be paid for, and 90% of everybody looking at this, looking at me right now, will not have to raise a tax bill to pay for this. In fact, they will be paying a fraction. Their taxes or premiums, which will go to Uncle Sam, like my Medicare does, will be less than what a fraction of what they're paying, probably a fourth to a third of what they're paying now for private health insurance. Now you know what it costs you right there. That's one of the ways we'll pay for it, is what they're going to charge you, what you're going to pay to Uncle Sam on a sliding scale. Business will pay about a little over 4% of their payroll, and that's going to be about half of what they're paying now. And that's going to help the economy, because business with that extra money is going to expand. And when they expand, they're going to be able to buy more equipment, they're going to be able to put more people on, and that's going to help this terrible economic situation that we're in. Healthcare is one of the biggest components. Another very big factor is eliminating the insurance companies. Those guys take about 33% out of every healthcare dollar. That's what those premiums go toward, profits, and these top executive salaries are of $15, $20, $50 million a year. And incidentally, if you're worried about the employees of the health insurance company, they are taken care of. They're given priority for the millions of new jobs that will appear in the new system. They will have their health care even while they're training for the new jobs. So they're taken care of. We're not gonna hurt them. It's just that CEO making the 10 or 15 million bucks, he's gonna have to go look for a job making 10 or 15 million bucks elsewhere. Let's see, that's 3 of the big ways. A 4th way is to put a health surcharge, you can call it a premium or a tax again, on those making over approximately $300,000 a year. A man making $1 million a year is going to pay maybe an extra $100,000 a year, but he's not going to be hurting too much. We're not going to we're not going to cut him out. He's going to have $900,000 left, and with that he'll be able to afford luxuries that you and I and 95% of all Americans out there can't even get close to. So he'll still live on a very high standard of living. You don't have to worry about him.